So, hello students, this is our second lecture number 2, and from here we will be starting our syllabus. The topic of today is cellular adaptation. Yesterday we saw very briefly what it is. We saw a few slides and I tried to explain you with some those schemes, what is hypertrophy, hyperplasia and metaplasia. And now we will see cellular adaptation in a very detailed manner. So let's begin. What is cellular adaptation? Cellular adaptation are reversible changes in cells to cope up with changing environment. What can be stressful conditions? It can be UV rays, it can be ischemia, it can be mechanical stress, or it can be our pH changes. For example, our pH changes, we will see in the Barrett's esophagus, there is a pH change which causes metaplasia. Now, another thing about cellular adaptation is once the stress exceeds the adaptive capability, cell undergoes damage. We saw yesterday, like if you are on a mountain, your body will try to adapt, it will produce more hemoglobin, the heart rate will increase, and still you are fine. But let's say you go 10 kilometers above the earth's surface, what will happen? The temperature will be very low, you will get frostbites. So those will be what? Those will be cellular damage. The cell will start to freeze up, it will undergo damage, but that would be still reversible cell damage. And if you go even beyond it, the temperature will be -50, -55, UV rays will be there, and the cell will undergo this time irreversible cell damage. So once the stress exceeds the adaptive capability of the cell undergoes damage, initially reversible and later irreversible. But once you remove the stress, cell resets to original state. For example, if you go on the mountain, your hemoglobin is high, your heart rate is high, but when you come down, it again resets. So when a cell is in stress, cell will adapt, and if you remove the stress, cell will come back to its original state. That is your cellular adaptation. Now in the cellular adaptation, you have a few things to study. For example, hyperplasia, increase in cell number. Second is hypertrophy, increase in cell size. Third is metaplasia, it means change in cell type. And the fourth is atrophy. Atrophy is a gross term for reduced organ size. See, if this is organ, if you have to reduce the size of organ, what can you do? Either you will kill all these cells, or you will make the cells smaller. Anyways, the size of the organ will reduce. Either you reduce the size of the cells, or either you kill some of the cells. The size of the organ will reduce. That is why atrophy is not a microscopic term. Hyperplasia is a microscopic term because the cells are undergoing changes, and you can see it there. Hypertrophy is also your microscopic changes. Metaplasia is also your microscopic changes, but atrophy is a gross term. Always remember it. When you read Robbins, it's mentioned there. Now let's see what is hyperplasia. What is hyper? Hyper means increased. And what is plasia? Plasia means growth. Okay, so what does hyperplasia means? Hyperplasia means growth factor mediated proliferation. Proliferation is division of cells. Growth factor mediated proliferation of cells under stress. So why have I called it growth factor? Cells don't divide by themselves. Otherwise, they turn into what? They turn into a tumor or cancer. But there is a requirement of stimuli. For example, when you enter puberty, what happens is you start, your height is suddenly starts to increase abruptly. Why is that? Because your growth hormones are now at the peak. So your growth hormones input your body to increase in size. It inputs to divide cells. Similarly, these growth factors inputs the cells to increase in number when there is a stress, and that is hyperplasia. What is the mechanism? As I said, growth factor. So the mechanism is growth factor induced proliferation. Since this is growth factor induced, this is most commonly seen in what? Organs which are dependent on hormone. Organs dependent on hormones. I'm really sorry for my handwriting because I can't write faster to the rate which I'm speaking. Now, since this is growth factor induced proliferation or division, it will happen in what cells? It will happen in only the cells which are capable of division. So hyperplasia doesn't occur in terminally differentiated cells. What are terminally differentiated cells? Your neurons, your muscle cells. Those are terminally differentiated cells and they cannot divide. However, this is highly seen in what cells? For example, your fibroblast, your epithelial cells. Okay. One more thing, as I told you earlier, if you remove the stress, the cellular adaptation is also reset. So yes, removal of stimuli results in reversal of adaptation. Got it? This is your hyperplasia. Now let's see this photograph. In the first photograph, you see these are the glands made of cells. By the way, this is your endometrium. And you see here, what is the difference between the first picture and the second picture? In the first picture, you see lesser glands, and in the second picture, you see there are large number of glands. Glands here are made up of epithelial cells. You know what kind of secretory cells. So tell me one thing, in the first picture, there are less glands, it means there is less cells. In the second picture, you see there are more glands, it means there are more cells. Why? Because this is normal one and this is hyperplasia. Hyperplasia, it means increase in cell number. And if you remember from the embryology and the physiology, what hormone causes hyperplasia during the menstrual cycle? Yes, that is estrogen. When the stress is there or when the physiology needs it, estrogen will be produced. It will go to your epithelial cells which lines the uterine endometrium and forms the gland. It will act on it and it will increase the number, and that will cause endometrial hyperplasia. Well, I said it happens in physiological condition also. So yes, there are two types. One is physiological and another is pathological. Physiological is when your body needs hyperplasia. Pathological is something when there is some sort of disease which is causing the formation of large level of hormones, which will also cause hyperplasia. For example, let's say there is a polycystic ovarian disease or granulosa cell tumor. Granulosa cells are the cells which form the estrogen. So what if there is a tumor of granulosa cells? There will be large number, large volume of estrogen produced. If there is more growth factor, there will be more proliferation. So yes, that will also cause your hyperplasia. So let's see physiological and the pathological one by one. Physiological hyperplasia. Let's see first the physiological hyperplasia. Now see, physiological hyperplasia can be of two types. One, when there is a patient who had some trouble with his liver, and his liver was resected, or surgically his liver was removed. Now a liver can grow almost from the half. So how does it happen? The cell needs to divide. So in that condition, that is also your physiological need. So physiological hyperplasia can be of two types. One, compensatory. Compensatory means the cell will divide to compensate the lost number of cells. Got it? While the second one will be hormonal. This is not compensatory, this is hormonal, where in uterine endometrium, estrogen will be produced, and in a stage of menstrual cycle, in every month, the uterus will go hyperplasia. So hormonal is to support physiological need. Example, breast during puberty. There are secondary sexual characters and the secondary sexual changes which is caused by estrogen, as you have studied in your 8th, 10th, 12th, and in the first year of your MBBS. So that is caused by estrogen, and we are talking about here hyperplasia. So that hyperplasia, because of estrogen, is causing the breast changes during the puberty as well as during the pregnancy. Got it? During the puberty, the estrogen will come from your granulosa cell, while during the pregnancy it comes from granulosa cells plus placenta. Because estrogen, your placenta produce large number of hormones like human placental lactose and HPL and so on. Now this was your physiological hyperplasia, and we saw compensatory and we saw hormonal. Let's see compensatory in more detail. We saw compensatory was to compensate for the lost number of cells. What can be the example? Let's say there was someone who underwent an accident. It means he lost large volume of blood, and blood is made up of cells. So there is also the loss of blood cells. So here also bone marrow will undergo hyperplasia. Got it? Liver during surgical resection will also undergo hyperplasia. Got it? Now let's say why do we say, like, if the skeletal muscle is cut down, it cannot grow? We know that the skeletal muscle cells cannot grow or divide, but what about the cells which can divide? Well, you have kidney have large kind of cells, different category of cells. We can't say like if you remove the kidney half part, the kidney will grow, but we see it that if you remove even the half of the liver can grow. Why is it? Because the cells of the liver has a factor. This is known as scatter factor. Suppose this is a normal cell. If there is a growth factor, the cell will divide into two. This is a normal growth factor. But in case of the scatter factor of the liver, it will help the cell to divide, and it will also help the cell to migrate. That is why you can say the liver is having a large volume of hyperplasia, which helps it to restore its normal state. So what will happen is, this is scatter factor. The cell will divide and it will migrate, divide, migrate, divide, migrate. But in the general growth factor, the cell only divides. But if it can migrate, let's say this was your liver and this was your cut part. The cell will divide from here, it will migrate here, it will migrate here. Again, the growth factor will reach here. This will divide, migrate here, migrate here. Now it will also divide, and this way the entire liver will be filled with the liver cells, or the hepatocytes and other kind of cells. For example, your epithelial cells and other cells of connective tissue like fibroblasts. Why? Because the liver has scattered growth factor, or the scatter factor. This is also mentioned in the Robbins. So we saw it was our physiological hyperplasia. Physiological hyperplasia has two types. compensatory, and the hormonal. Compensatory is to compensate the lost number of cells, while the hormonal is to support the physiological need. Now let's talk about the pathological hyperplasia. Pathological hyperplasia. What is pathological hyperplasia? Pathological hyperplasia means increase in the number of cells due to a pathogenic condition. For example, hemolytic anemia. Hemolytic means what? Hem means blood, lytic means breakdown. And anemia where there are large number of RBCs which are undergoing breakdown. Well, this is caused due to some sort of pathological condition. So this is a disease. And there is hemolytic anemia, but your body needs oxygen and nutrients and everything. So what your bone marrow does is it undergoes hyperplasia again so that it can make more blood cells. Now if bone marrow is again undergoing hyperplasia, this is what kind of hyperplasia? Pathological. Why? Because hemolytic anemia is a pathological condition. So this time bone marrow hyperplasia is pathological hyperplasia, while previously compensatory to compensate the lost number of cells. For example, during some accident, it was to compensate the lost amount, but here this is to compensate the lost amount due to a disease. Previous it wasn't a disease, now it is a disease. So this is pathological hyperplasia. For example, bone marrow hyperplasia in a pathological condition like hemolytic anemia. Now pathological hyperplasia has also role of hormones, because this is growth factor induced proliferation. So in case of males, you must have heard about benign prostatic hyperplasia. What happens in males is that in a large number of males, after like 40-45, the prostate cells starts increase its division. So let's say this was your prostate, this is a transverse section, and this was the lumen. What happens is, if you start filling more cells and more cells, what will happen? This lumen will reduce in the size. This will result in the difficulty in urination or dysuria. You give various drugs which you will study in the pathology, but this is benign prostatic hyperplasia. Benign because this is non-cancer, prostatic because this is prostate, and hyperplasia, it means increase in cell number. So this was caused because of what? This was caused due to estrogen. Similarly, hormone causing a pathological hyperplasia in females, this is due to what? This is due to estrogen. Now there can be a large number of conditions where it takes place. For example, endometrial hyperplasia. Endometrial hyperplasia, it takes place every month in female because of the physiological demand to prepare the endometrium to ready for the pregnancy. But what if there is no pregnancy and the cells have some sort of tumor or any kind of pathological condition? In that time, endometrial hyperplasia will be pathological endometrial hyperplasia. Example, there are many. For example, first, etiology. Etiology means underlying cause and risk factor. One is PCOS, polycystic ovarian syndrome, or also known as polycystic ovarian disease. What happens is there is excessive estrogen and it causes proliferation of cells. Now estrogen usually shifts to progesterone, right, during the menstrual cycle. But what if there is a large volume of estrogen? It will not shift to progesterone, because estrogen only shifts to progesterone when the estrogen level starts to reduce. But here it is not reducing, it is even increasing. So it will never shift to progesterone. So what will happen is the endometrial will start, it will continue to get thickened and thickened. And that is endometrial hyperplasia due to PCOS. Now, so the second one is anovulation. Anovulation means abnormal menstrual cycle with hindered phases. Again, here there is large volume of estrogen. The third etiology is obesity or the fat. So in obesity, obesity means the people with a very high BMI, mostly because they have large volume of fat in fat percentage in their body. Obesity. In the obesity, people have large volume of peripheral fat. This peripheral fat cells or the adipocytes converts estrogen into active estrogen. And this is the reason why, again, people will have irregular menstrual cycle. In all of them, whether it's PCOS, anovulation, obesity, all of them will have irregular menstrual cycle. Since there is large volume of estrogen, people can have facial hairs, which is known as hirsutism. Irregular menses will also be a factor here. Well, what is the treatment of obesity? Only physical exercise. You cannot treat obesity with a medicine. Now the last one which I have saved, that is granulosa cell tumor. What is granulosa cell? In the embryology you have studied, these are the cells which forms estrogen. So suppose there is one cell forming one unit. Now this converted into tumor. Now there are almost 5 cells. They will form 5 units of estrogen. Well, if there are 1 unit of estrogen causing 1 centimeter growth of endometrium, the 5 centimeter will cause 5 centimeter of growth. It means the uterus is under hyperplasia.